So we talked a little bit about prevention. Now, what are your recommendations if you contract H1N1?
Similar to prevention in the sense of contact your CF center, discuss with them your symptoms, and in fact, if they believe you have H1N1, and discuss the idea of the antiviral. The next thing I want to do is talk about your treatments and how many treatments you should be doing a day, whether you're a person who should be on a prophylactic antibiotic to prevent you from having a lung exacerbation. You definitely should get rest. I mean, I think, I appreciate that people are in college or school and they don't want to miss, or, they're worried about losing their jobs, but it's really important. Rest is really your best way of getting better faster. It's important to keep your temperature down below 101 so you don't lose excess fluids and salt. In that situation, you certainly want to make sure you get good hydration and plenty of salty products. I'm a big proponent of chicken soup. You also want to make sure you do your therapy regimens as you should be doing them, and you may even have to do more to prevent you from getting a lung exacerbation.
If I get the H1N1 flu, what therapies should I increase?
I think the most likely thing that people are going to increase is just the idea of airway clearance. And so if their airway clearance regime is to do, a bronchodilator and something like hypertonic or pulmozyme and the vest or acapella or flutter, whichever, or chest PT, whichever device, in general, it's possible that all will go up, which is very time consuming and difficult when you don't feel well. But again, that's where, support comes in at that time.
Dr. Germana, what do you recommend if someone that you are living with contracts H1N1?
Well, the first thing is to be reassured if you got the vaccine that you're not going to contract the illness. The second thing is that if you have not received the vaccine, it's important to call your center immediately to find out what they would like you to do in particular. The next thing is to try to isolate that person as much as possible. In regards to that, it's, you don't want them hanging out in the family room with everyone or sitting down to the dinner table with everyone. You also will want to avoid, any kind of, hugging of that person. And I know that's difficult because, it's a family member, but, when they're sick, you want to avoid that kind of contact. And don't share things like utensils with that person. Try to keep your toothbrush away from their toothbrush. Those kinds of potential transmission of oral secretions.
I really always want to be ready for battle. So should I have the Tamiflu at home and ready to go in case I get those symptoms at like 9 o'clock at night and all of a sudden I'm zonked out?
I think it's not a bad idea to have a prescription available in the case that you do come down with symptoms.
Okay, so say you do come down with the symptoms, but you're not sure, but you're a little paranoid, so you start taking the Tamiflu. How long do you take the Tamiflu for? And do you have to run it? Do you have to take it for its full course versus just take it for a day or two and stop?
Sometimes we have patients that we think they have H1N1 and we start them on the antiviral, and then we get the culture result that in fact it's not H1N1, and we have stopped patients after 2 days, or and so that's not unheard of. So you don't need to complete the course if in fact you really don't have H1N1.
If I start taking the Tamiflu, I take it for the 5 days or 3 days, and we find out that I didn't have H1N1, so I stop it. A month later, I get another flu-like symptoms, and would I start it again, or it's not effective?
Okay, so if you believe you had H1N1 again, a month later you would consider, you'd have a discussion with your doctor about taking a second course. A full course possibly. Your insurance company may not pay for that second dose. Some insurance companies will pay for one a month later and some will not. So then you have to make a decision about whether in fact that's something you pay for out of pocket, or is it, you certainly discuss with your doctor whether you should take it or not.
Should a person start Tamiflu if they've been symptomatic for more than 48 hours? Will it help them?
It may help them abort some of the symptoms and get better a little quicker. It's theoretically not supposed to, but have we done it? Yes. And have the patients done okay? Yes. So I think, again, it's a matter of you discussing with your doctor about how sick you are or how sick your child is and whether that's a good thing for you to do.
Regarding H1N1, is it also recommended that you be taking Tylenol or for fever, or it's not going to help?
It's an interesting question, and I want to answer it in this way. They have found that children who take Tylenol after they receive a vaccine may have less of an antibody response to that vaccine. So certainly after you get the vaccine, don't go running out and taking Tylenol or Motrin. If you have the illness, what you want to do is, Tylenol is better because it doesn't interfere with your platelets and your clotting. So it's better than Motrin or any of these non-steroidal anti-inflammatories in that regard for our patient population. If your temperature is above 101, you definitely want to try to get that temperature down because you lose a lot of fluid, and in our patients, they lose a lot of salt, so they'll become dehydrated and won't feel well. So you want to keep your temperature below 101, and Tylenol is one of the ways, acetaminophen is one of the ways that you do that.
So if you're taking Tamiflu, you would also take Tylenol?
If you are symptomatic, which is, if you're somebody who's taking it twice a day for 5 days, our recommendation would be to take acetaminophen, yes.